I'm so pleased to see, but not surprised at all, that we have such a great turnout from people all over the country. Welcome, and thank you for joining the NeedyMeds special topic webinar, RX Outreach, Making Medications Affordable. We're going to dive right into the topic in just a moment, but before we do that, and before I have the pleasure of introducing our guest, I want to introduce myself. My name is Carla. I'm the Director of Education at NeedyMeds. And before we do dive in, I just want to go over a few housekeeping tips. You can feel free to type any questions you may have throughout the presentation into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end of the webinar. If we don't have time to get to your particular question, we will follow up with you via email personally after the after the webinar by tomorrow afternoon. But of course, we will also provide you with the contact information for both NeedyMeds and RX Outreach. Also, this webinar is being recorded and will be available for viewing on the NeedyMeds YouTube page. And you can find access to that page on the top right hand of the NeedyMeds homepage. So let's get started. Right on your screen is just a slide that indicates NeedyMeds' updated mission statement. We updated it at the end of 2016 to more accurately reflect what we do, which is that NeedyMeds, a national nonprofit, is dedicated to educating and empowering people seeking affordable health care. And as we all know, that really knows no boundaries. It affects everybody, regardless of income, access to health care, and socioeconomic status. So an important part of the mission, as you can see, is educating people. And we certainly define that portion of our mission by saying that we educate people about NeedyMeds and the resources we offer. But we also define that education part of our mission in another way, by making sure people are educated or aware about other ways to save on healthcare expenses, which is why we are so pleased to have our guest panelists here with us today. In the meantime, as I introduce our panelists, I'm just going to put a snapshot of the NeedyMeds homepage up there. And just FYI, the top right-hand of that page, you can see all those little icons. That's where you can find our access to our YouTube channel that I mentioned. And at that navigation bar in the top, patient savings is where you'll find all of our healthcare savings resources. So anyway, I'll leave that up while I introduce Pete Wyatt. Pete heads up the marketing and provider relations team for RX Outreach. Pete's primary goal is to share and serve low-income patients and their providers, helping to ensure that those in need of affordable medication have access. And when I describe RX Outreach, I always say it's almost too good to be true, because it's almost an oxymoron. It's actually a nonprofit pharmacy. And sometimes that sounds a little bit too hard to believe, which is why we have Pete here to walk you through some of the details and why you should really be aware of their organization. So I am going to hopefully seamlessly now pass the mic and the screen to our guest. So Pete, you should be able to take it away. And thanks everybody for your patience, and enjoy today's webinar.
Well, I think I may have just pressed the wrong button here. I'm sorry.
It looks like you're all set. Oh, you're pulling up your PowerPoint?
Yes, that's what I'm doing. Exactly.
Sure. I'll give Pete a moment to do that. And actually, what you're looking at right on his screen is the homepage to the RX Outreach website. And as you can see, it's very easy to negotiate. And of course, we'll provide you, as I said, at the end of the presentation with the contact information and the web addresses for both RX Outreach and NeedyMeds. So don't worry about jotting those down. Oh, and actually, Pete, that gives me an opportunity to remind everybody that logged in the handout section of your GoToWebinar control panel, you will find copies of both my PowerPoint presentation, but much more importantly, of Pete's PowerPoint presentation. Certainly let me know if you have trouble accessing that. Okay, thanks, Pete. Enjoy, everybody.
So can we see this now? I hope everyone can see this. I hope I've pressed all the right
Yep, you pressed all the right buttons. Your PowerPoint is clear and large. Thanks, Pete.
Fantastic, thank you. Good afternoon, all, or good morning, depending on where you are in this country. Thank you for attending. Today, I'm going to introduce you to RX Outreach. As Carla said, we are a bit of a unicorn in the sense that we are the only nonprofit, fully licensed mail order pharmacy that serves the entire country and only focuses on low-income patients and their providers. So today, what we're going to do is I'm going to talk you through a couple of things. You know, what actually is RX Outreach and actually what we are not, which is as equally important. When to consider RX Outreach, and why RX Outreach, and how to choose RX, or how to use RX Outreach. And I can't believe they just started digging outside of my office here. So if it gets too unbearable, somebody please let me know. So here we go. So what is RX Outreach? As I said, we are a nonprofit mail order pharmacy. We are an actual pharmacy, 31,000 square feet of automated warehouse, staffing, pharmacist, everything that is a pharmacy we are. The difference is we are mission to work with safety net providers to serve those in need. So in serving those that are in need, we are working through low-income safety net providers, free and charitable clinics, advocates of all kinds, and we are serving the needs of those people that don't have easy options. We serve all 50 states. On hand here, we have more than 360 medications in 850 different strengths. We have those medications on hand, and they are not free. So we are not a free source. That kind of comes up next, but we are not a free source of medication. However, we are advocates of free. If you can find it free, we certainly want to help you find it and help you get it. We are advocates of cheap. If you can find it cheap, great. We absolutely want that to happen. If you can find it local, if you can find it at a better price or more availability than we have, we are advocates of that. Our primary purpose is to make sure that the one patient you have a year, or if you in fact are a patient, that you have one incidence a year, that you cannot find the right dosage, the right medication, the right timing, the right price. We are here to fill that gap for you. We shipped over 350,000 prescriptions last year. We shipped, and 9,000 of those, or more than 9,000 of those, went to NeedyMeds referrals. So we are an active partner of NeedyMeds. We share similar missions. We do a lot of things in the same way to serve the same people. So this relationship is good, and it's about serving more people across the country. We do not require coupons. We are the pharmacy. One of the things that we have is transparent pricing. So if you visit our website, the pricing you see there is for 90 or 180 days. It does not require a coupon. That is the price that is shipped to your patient or your clinic. There are no hidden fees. Nor do we offer a discount card. Again, we are a pharmacy, nonprofit pharmacy. Our products are not marked up. Discount cards are not something that we can use in our model. However, as we move through this, one of the most effective discount cards we work with and come across the country is the NeedyMeds card that Carla's going to talk to you about a little later. So one of the things that's not listed here that's very important to know, we are a pharmacy. However, we are not in this business to be your silver bullet pharmacy. We don't carry all of the medications you need. Because we are mail order, we cannot meet short turnarounds with antibiotics and things like that. So when considering when to use us, please do not discount, and I don't think you would, discount your current pharmacy relationships. If we are better for your patient, then use us. If we are not advocating you change your process, your relationships, or anything. We're just asking that you consider adding us to your resource list because we can help. So when to consider RX outreach. If you are a provider or a clinic, these are probably the top 5 or 6 things that we run across the country. When you have exhausted all options for free medication, if you can find it free, God bless you. We want you to have it free. However, free does have a price. Free is not always the right dosage. Free is not always the right medication. Free is not always the best thing for your patient. So again, this is why we're here. Another reason is when the patient does not qualify for assistance, a PAP or Medicaid. We have thousands of patients that are in this particular predicament and they cannot qualify for one reason or the other on PAP or Medicaid or any kind of program. We do not require patient documentation. We don't need paychecks. We don't need green cards. We don't need social security numbers on non-controls. We try to make this easy. So those patients that don't always qualify for the city program, the county program, the state program, the federal program, whatever that is, more than likely we will be able to serve that patient if you have deemed them, that they need this medication. On a local basis, when the existing pharmacy relationship does not have the needed preferred medical strength, we have a lot of partners out there that have their own pharmacies or their own dispensaries, or they went to high school with the pharmacist at the medicine shop. All of those things are absolutely wonderful. But if in the event that the pharmacy down the street does not have 30 milligrams of drug X, and that's what you need, or they don't have the right generic, or they don't have something, chances are our formulary will carry something that you can use. When the patient's compliance is threatened by mobility, because we are mail order, we serve urban situations where people don't have transportation and it takes them 2 buses to get to a clinic. Therefore, they're not compliant with their meds. Or they work and their schedule is not compliant with going to the clinic. Or in many of our situations in Texas and Carolinas and up in the Northwest, it's a rural environment and the next clinic is 50 miles away. Can that patient get 30 days of medication for $10 in town? Absolutely. Our cost of $18 for 90 days better suits that patient at their home, if that is the address of choice. If you are a patient or a caregiver, the primary reason we get used is if for any reason the patient or the caregiver or the provider is spending any of their own money, we are worth consideration. And when we say that, we are speaking to the use of the wonderful, no knock against them at all, retailer programs where you have $4, $7, $11. That is an absolute great program, but it gets into a gray area. If you were paying $11 for a local medication for 30 days, and that's what the patient can afford because it's easy, that's great. However, if we have that same medication for $18 for 90 days, that's another consideration to consider. If you are a patient when you do not qualify, we just talked about that a little bit. If you don't have documentation, we have clinics that we work with across the country that serve undocumented, that serve migrant workers, and we work it out. If they have prescriptions, we will get it to the clinic and the clinic will forward the med. Or we will get something from the patient as authorized by the clinic to forward it to, we have situations that follow the racetracks. So we work that out. We are here to serve those patients. When the patient has more than one medication, and this goes back to that retail situation, it's great that you've got an $11 medication that's cheaper than anywhere else you can find it locally. However, if the patient has two, that other medication is $100 or $200, and the patients we serve are likely to walk away from both of those and present the next time at their provider with worse situations than they left with. And then again, we talk about when the compliance is threatening the mobility or lack of ease. We know that many of our patients take the bus to get to a clinic. We know that many of our patients work 3 jobs. We know all of those things. So our model is designed to specifically address the needs of low-income folks that are working hard, that are transportation challenged, that have other issues in their life. So we work hard to minimize our systems, streamline our systems, and to work with the provider so that it's easy to take advantage of our offerings. Why use RX Outreach? Lots of reasons. We are a nonprofit and we are missioned to focus on the patient. Our job is to assist you in any way that we can to serve that patient and to keep that patient out of more expensive care, i.e. the emergency room. Another reason to use us is we are absolutely transparent. When you see our pricing, that is the price that is a delivered price to either the clinic or the patient. We do not require enrollment fees. We don't require shipping fees, the standard shipping fees, or there's no membership fees. There are absolutely no additional or hidden fees. $20 for 90 days is $20 for 90 days. Again, we understand who we serve. We also understand how they get nickel and dimed in unfair ways. We serve the uninsured, insured. Again, it goes back to if you're out there and you are 300%, or if you're below 300% of the FPL, as listed there on the screen, we will serve you if your doctor has provided you with a prescription. We are a sustainable source. One of the things that I mentioned earlier is that free has a price. Free also runs out. And when we consider the patients that we serve, again, we get 8,000 to 9,000 calls a week here. And there are so many patients looking for a medication because their initial source ran out. We buy 85% of our medications through a buying group from the manufacturers that serve Walmart, Walgreens, CVS, Medicine Shop, Albertsons, all of those pharmacies. We buy the same meds, we have the same meds. Our position in this continuum of providing medications is we want that medication on hand when our patients need it. Because it's not as simple as the patient not having their medication, but that patient at this level, if they don't have their medication for a sustained period of time because it's unavailable, it's not that they don't just have it, but their lives begin to unravel. And that leads into other things. Again, community health costs go up, community safety goes up, all of those kind of things. And then again, as you are here through NeedyMeds, another reason why to consider us is that we are committed to serving and supporting NeedyMeds. Carl and I spoke a little earlier today about how we can even expand our relationship a little further. But we are committed to serving this population of patients and this population of providers and finding easier ways to do it. So how to use us. This slide could go away in about 30 days, maybe 60 days. But we are constantly trying to find easy. How do we make this process easy? We understand that providers can't, if you're an advocate, you've only got so much time in the day. So how do we make this easy? So For us, we use the word enrolled. I challenge that. We challenge that. Enrolling takes the attention away from the medication that the patient needs. So we don't want to say enrollment anymore. We don't even want to make enrollment a active pursuit. But ordering the medication can be clinic initiated. It can be patient initiated. That has no bearing on our process at all. However, the enrollment can take place if you go to our website, and I invite you to go to our website at rxoutreach.org and look around, check our medicine list, or you can give us a call. Personally, I think calling is the best way and fastest way. However, again, full transparency and full disclosure, our call volume has gone up since November from 7,000 to 9,000. So we've got to figure that out, and we've got some weights. Again, if you're an advocate, if you're a patient and you need a medication, to sit on the phone for 5, 7, sometimes 12 minutes is a bit much, but it's easier. And then you can always mail in the application. So there's an application out there. You can always do that. But again, I recommend phone call or going online. It's just much easier. Enrollment, again, we'll use that term. We're only asking really 4 questions. We want the patient's name. We want the patient's address or the clinic address if that's where the medication is going to be shipped to. That is the choice of the provider. And we need household income. Again, we don't need that documented. We just need you to tell us that you're under 300%. We audit every year. But there has to be some commitment to serving the mission. So if this is coming from a known provider that serves low-income people, why drag them through more documentation and verification? And the other part of that is we need the prescription. Prescriptions must come from the provider. This is a tricky question. As I stated before, we're not free. That is not our role that's not our position in the continuum of providing medications. So upon enrollment, your enrollment and your file is set up instantly. However, your shipment is 4 to 6 days from payment. If you're paying on phone, if it's Monday and you're paying via credit card, debit card over the phone, you'll have your meds Thursday, Monday. If you are paying by money order or any of those other kind of things, it usually takes some time to get here. We've had it take as long as 60 days, which is kind of scary, but it's happened. You still have a 4 to 6 day shipment, but it doesn't ship until payment is received. And then as far as refills and prescriptions, reminder notices, and those kind of things, we send them directly to the patient. However, if the clinic, in terms of compliance, wants to be notified as well, we can do that. The other thing to note here is we do not force refills. Part of serving this population is that the credit card you have on file is the credit card you had on file last month. Is not a good card this month. There is income disparities. They can't afford it, lots of things. So what we will do is we will reach out to the patient and or the facility and ask, is this medication, is this refill still wanted, still needed? Is the card still good? Do we need to change the card? So we take a little bit more care because, again, we understand who we serve and how difficult things can be. So that's us in a nutshell. I offer more direct one-on-one conversations if that is warranted with anyone. Here's our contact information. The clinic services team, which is this group of 3, is small but capable. We're handling hundreds of clinics every week, I should say providers. And we're looking forward to answering your questions because I know each and every facility or person has a specific. So with that, I will open that up and take any questions that might be.
Pete, as always, thank you so much for taking the time to share your expertise with the NeedyMeds audience. If you would, I'd appreciate it if you can go ahead and switch the screen back to me so I can grab it. And this is a great time for me to remind our audience, I do see some questions coming in, that if you have any questions for Pete, certainly type them into the questions section of the GoToWebinar control panel. And as those are coming in, I will take just a moment to remind everybody, Pete does a great job in the beginning of clarifying what RX outreach is not. And as Pete has mentioned, we actually had a conversation earlier today about, as he said, furthering the partnership between RX outreach and NeedyMeds. But I did think Pete's explanation, which we spoke about earlier today, and he started his presentation off with what RX outreach isn't, is really helpful. And I think NeedyMeds can take a cue from that, because sometimes organizations such as RX outreach and NeedyMeds, if you're not familiar with such entities, quite frankly, it can be a little hard to get your head around it. And we at NeedyMeds encounter the same problem that RX Outreach does, which is I think people sometimes think we're too good to be true and are afraid that we're actually credible organizations. So one of the things that Pete had mentioned during his explaining what RX Outreach is not is that one of the things RX Outreach doesn't do is they don't provide a drug discount card. And I just wanted to take a moment to remind everybody, if you didn't know, that NeedyMeds does, in fact, provide a drug discount card. I'm sure you've heard of drug discount cards. There's dozens, I don't know, maybe hundreds out there. NeedyMeds card is different because not only is it free, it's anonymous, which means not only don't we ask you for any of your personal information, but if it were out there, we don't track it. So you can be assured that we're not tracking you, but more importantly, we would be unable to share your information simply because we don't obtain it from you. So here's a quick slide about what the drug discount card is good for. It's a great safety net to have. You can download it onto your phone. You can have a paper copy printed out from our website, or you can keep a plastic copy of the NeedyMeds drug discount card in your wallet. And it's a great safety net if you ever find yourself in a position of having to pay out of pocket for a medication that NeedyMeds or RX Outreach wasn't able to help you fill through another program. So I wanted to put that up there, and a reminder that we do offer other cost savings healthcare options as well. So don't hesitate to visit the NeedyMeds website. And like Pete had said, he says the easiest thing is to just pick up the phone and call RX Outreach, and I will mirror that sentiment for NeedyMeds as well. Don't hesitate to call our expert call center counselors at our 1-800-503-6897 if you have any questions about how we can help you afford your medications or other healthcare costs. And again, I'll have that contact information at the end of today's presentation. In the meantime, Pete, we do have a bunch of questions coming in, and one that we get probably every webinar is, would you drive home the answer to this question, Pete? How much does RX Outreach cost to both the patient and the provider?
Okay. It costs the providing absolutely nothing. There is no usage fees. There's no membership fees. We don't have minimums. We don't have maximums. From the patient perspective, it costs the patient absolutely nothing, except the cost of the medication they use. So we don't require, there's nothing. Our mission here is about the medicine. It's not about membership. It's not about fees. It's about getting that medicine there. So there's no additional charges. Some of our programs require that we ask a provider to sign an MOU, but that's not about cost. That's about HIPAA and what's the other one? It's about HIPAA and I can never think of the word, indemnification. So we're a user-free service, I guess. I hope that was clear.
No, that was very clear, and I'm glad that question came in because it's something that I think almost in every webinar somebody asks that, and it's wonderful to give Pete an opportunity to drive that point home and make it as clear as possible. Pete, we had another question coming in I thought was an interesting one. It wasn't a term I was familiar with. I'm sure you are and many of our audience members are any of the medications sipped, and hopefully I'll phrase this correctly because the question is in front of me, but with bubble packs? And when I asked our audience member to clarify what she meant, what was meant was, I guess, if there are a patient that has difficulty opening the package. Is that something that's familiar to you, and can you speak to that for a moment?
That is. We ship in child-proof amber bottles, which, to the question, is sometimes complicated for our seniors. We evaluate bubble packs all the time. Again, as a nonprofit, it's not about we can do this and that. We are in a this or that environment. So right now we're at amber bottles. We would love to get to other forms of distribution, but we do not do the packs.
Perfect. Thank you so much. Here's another great question from an audience member. What document is considered sufficient by RX Outreach to verify the prescription?
To verify the prescription. We take e-scripts. We take, however the clinic legally documents a prescription, that's what we accept. So it changes from state to state and sometimes from county to county. But whatever that legal document in the state of Idaho, Massachusetts, Georgia, sometimes they're different. Whatever that is, we accept. But it must come from the provider via e-script, fax, and things like that, or the mail.
Very helpful. I do have a couple of questions coming in, and just a reminder to everybody, it would be my pleasure to email anybody that's attended a copy of today's PowerPoint presentation, both mine and Pete's. You can also access it from the handout section of your GoToWebinars control panel. But again, if you have difficulty accessing that, certainly don't hesitate to let me know, and I'd be happy to shoot you an email. We do have some, yeah, what were you going to say, Pete?
I'll just echo that to say if anybody has, because we've got materials that may be specific to some other purposes that are available, and I'd be more than happy to send those out. Just as you're requested, no solicitation involved.
Wonderful. That's very helpful. We have some questions about whether or not we have a nurse case manager and is curious whether or not the member has to call themselves, or is this person, the case manager, able to enroll them on their behalf? Yes.
Vast majority, well, I shouldn't say vast majority, a significant number of our patients are enrolled by advocates. If it is legal in the state that the advocate resides to register a patient and do those things for the patient, that's quite honestly where we end up serving. So in many of those cases, if it is a nurse practitioner in a clinic, say, they will write the script, they will enroll the patient, we will then fill the prescription, send that prescription to in the patient's name, because that gets into the whole compliance mechanism for clinics. So if you are legal in a state that can do that, we accept that.
Perfect. Thank you. And that's a really great question from our case manager that joined us today. And I will also say that's true of NeedyMeds as well. If you work for a population of people that don't have access to the internet or can't make the phone call themselves, please know that you can always give NeedyMeds a call on behalf of the patient, client, loved one, neighbor, family member, and we're happy to provide you with the information, hopefully that will help that individual and their family save on their healthcare costs. Another couple of questions, and then for those that are still coming in, a reminder that we will follow up with you individually if we haven't gotten a chance to answer your specific question. One of the ones coming in now, Pete, is, and another great question, does the income level apply nationwide or is it statewide? They use the example that you had on your PowerPoint presentation, an individual that makes $36,000 a year.
It's federal. We follow the federal poverty line because it changes. Also changes for Alaska and Hawaii. Those are a little different. So if that question is from Alaska or Hawaii, it is different. But all the other contiguous 48 are we operate through the federal.
Absolutely, and that's true of a lot of NeedyMeds programs that we have listed. The federal poverty level comes into play, and it is federal. It's not statewide, but as Pete said, there are different criteria for people in Alaska and Hawaii. I am getting just some feedback that I'm going to wrap up today's presentation with, which is that a lot of people are looking for medications such as insulin, oral coagulants, inhalers, and those are, we certainly find at NeedyMeds, and Pete and I spoke earlier about the need for such things, in particular insulin, that those seem to be hard for patients to get because they are so expensive. The prescription assistance programs may have stiff criteria, or they may not be coupons available. I'm taking a moment to just say this comment out loud for a couple of reasons. One is, please continue to offer such feedback, because organizations such as RX Outreach and NeedyMeds, we cannot change our focus or meet your needs unless we know what they are. The other thing is RX Outreach is expanding. NeedyMeds programming is always changing. So just because something isn't available this week doesn't mean it might not be a couple of months from now. So I would encourage everybody to regularly check back if you can and be vocal about your feedback. Also, the other questions I'm getting in now really are just about copies of today's presentation. And so I'll just wrap up today's presentation by saying, again, this presentation is being recorded, and you'll be able to find it on the NeedyMeds YouTube channel. We do our best to get those up within a couple of days. So I would say by Monday, it will be up there, and you can find a link to the NeedyMeds YouTube channel on the top right hand of our page. Attached to your GoToWebinar control panel are the handouts of today's presentations. If you have difficulty downloading those, shoot me a message in the questions section or drop me an email. I'd be happy to re-email those to you. And I'm getting some other comments about people interested in NeedyMeds materials. And I will follow up with you offline tomorrow to see what you're in need of. And we will be more than happy to drop whatever you'd like in the mail. With that, I want to thank everybody for taking time out of what is no doubt a busy day to learn a little bit more about NeedyMeds, but most importantly about our partner, RX Outreach. I'm glad you had a moment to hear Pete explain not only the work that they do, but how hopefully it can help you, your family, your loved ones, and your patients. So thanks so much for your time. And Pete, thank you for sharing your expertise with the NeedyMeds audience. Have a wonderful rest of the day, everyone. Take care.